Dr. Joanne Samant. I'm a pediatrician with the May Street Reliant Medical Group site, and I'd like to take a minute and talk to you about the enterovirus that you may have heard about in the news recently. I'd like to explain what this virus is, what the symptoms are, and how it can be treated. Enteroviruses are very common viruses that we tend to see in the summer and fall. Most children who get these viruses have very minor cold symptoms and recover without any problem whatsoever. The Enterovirus D68 strain, which is the one that you may have heard about in the news, is not a new virus, but it is less common than the other strains of this virus. So what are the symptoms of this virus? Typically, they include sneezing, runny nose, some cough, and a low-grade fever. But some children, such as those with weakened immune systems or who have underlying asthma, may have a higher chance of having more severe symptoms, and these would include shortness of breath, wheezing, or trouble breathing. So how is this virus treated? As with all viruses, antibiotics will not help, but most people can be treated as we would treat a common cold, and that includes making sure that your child is drinking plenty of fluids and resting and blowing out their nose. If you have an infant with a stuffy nose, you can use some saline drops to help with the congestion. Most importantly, however, is to watch for any shortness of breath or wheezing or trouble breathing. If your child was previously diagnosed with asthma, make sure that you follow the asthma action plan that your child's healthcare provider may have given you, or to continue on any controller preventative medicines that were given. If your child's, again, short of breath, having trouble breathing, cough is getting worse, or the rescue medicine is not helping, then you need to call your healthcare provider and talk about your child's symptoms. While most children will recover from this virus without any problems, a few can become more ill and a few may require hospitalization. So be sure, as always, to call your healthcare provider if you have any questions whatsoever about this virus.